A medical emergency can happen at any time. In fact, one happens every 5 minutes here in the Tri-City area. If a situation is immediately life-threatening, the first thing to do is to call 911. But if you're not sure it's an emergency, you should call your primary physician. Not all situations call for going to the emergency room. Sometimes, a better choice is taking the patients to an urgent care clinic. But patients or those making the decision to seek treatment on behalf of someone must make the choice prior to coming to the hospital. Once a patient enters the emergency department for treatment, federal law dictates that the hospital must evaluate and treat the patient in the emergency room, even if treatment would be more appropriate in an urgent care setting. Your primary physician will be able to advise you in your specific case, but generally speaking, it would be best to go to Washington Urgent Care rather than the ER when immediate attention is necessary, but the condition is not life-threatening. Washington Urgent Care is most appropriate for conditions that need attention right away, but the patient's life is not in danger. For example, respiratory infections, colds, flu-related symptoms, fevers, vomiting, minor cuts requiring stitches, less complicated broken bones, and athletic injuries. Washington Urgent Care is located right across the street from the hospital at 2500 Maury Avenue on the second floor. The patients are seen by a board-certified doctor, and they can usually get in and out much quicker than is possible at the ER. The wait is often no more than 10 to 15 minutes, and most patients are ready to go home within an hour. You can check the current wait time online right on the homepage of Washington Hospital's website at whhs.com or call 510-791-CARE. That's 510-791-2273 to find out the wait time. Washington Urgent Care is open from 8 a.m. to 8 p.m. every day of the year and offers convenient primary care scheduling, same-day appointments, and walk-ins are welcome. For all uninsured patients, the Washington Urgent Care discount policy provides a 35% discount for uninsured, non-district residents for medical care. Uninsured residents that live within the Washington Township Healthcare District and do not qualify for free care will receive a 55% discount for medical care. Since most insurance plans are accepted, co-payments for a visit to Washington Urgent Care are considerably less than the out-of-pocket expenses associated with treatment in the emergency room. In fact, in some cases, treatment costs in Washington Urgent Care can be as much as 60% less than the cost of treatment for a similar condition in the emergency room. It doesn't take long to discover that, based on the high level of readiness constantly maintained in emergency room to accommodate any medical issue that comes through the doors. Treatment would be much less expensive in Washington Urgent Care. Of course, the choice of which facility to take the patient to should never be based on the cost alone. Let's summarize. In case of a life-threatening accident or illness, call 911 immediately. If the situation seems less dire, call your primary physician right away. Your doctor will advise you as to whether you should go to the emergency room or to the urgent care clinic. You should go to the emergency room whenever a life-threatening medical condition arises suddenly and you believe that immediate medical attention is crucial. If, for instance, there are signs of stroke or heart attack, severe shortness of breath, bleeding that can't be stopped, poisoning, a major head injury, complicated fractures, or suicidal or homicidal feelings. Washington Urgent Care is for those injuries and illnesses that are not life-threatening, such as respiratory infections, fever, cuts and bruises, and less complicated broken bones. If you or someone in your family ever does suffer a serious injury or illness, it's comforting to know that your local community hospital provides one of the best equipped emergency rooms and urgent care facilities around, with a highly trained, experienced and board-certified staff to ensure that you or a loved one receives the best and most appropriate care.